topic is a very important one to women, has to do with menopause, hormone therapies, and what options they have to avoid all the symptoms of menopause. Today I have my esteemed guest, Dr. Elizabeth Ramirez. She's an OBGYN surgeon, and she's the chairperson of her hospital in New Jersey, Christ Hospital. So I want to welcome you, Dr. Ramirez. Tell me a little bit about your practice and your experience.
Well, thank you very much for having me here today, first of all. So I have currently two practices. The name of the practice is called Jersey Women's Care Center. One is in Hudson County and the other one is in Bergen County. I've been practicing for about 17 years and have a very special interest in menopause.
And the reason why I invited Dr. Ramirez because I know this is not only her passion, but this is something she does every day. And I felt that was a very good way to have a segue into this conversation, talk to somebody who's really on the front lines discussing this with patients every day. So welcome again. Can you tell us a little bit about what menopause is? Tell us a little bit about what the medical diagnosis is.
So menopause is basically amenorrhea for approximately 12 months. And amenorrhea means not seeing a menstrual cycle. So it is a retrospective diagnosis.
So it's after the fact, and it's after the women have their last period for 1 year.
That is correct.
Then they're definitely in menopause. What do women really share with you? What is the big thing that drives them to discuss this, or how does this topic come up in your office?
So there's certain women who are highly expressive, and there are certain women that if I don't ask the question, they will not tell me that they're going through the changes of life. And the women that do come in for consultations, the most common symptom is hot flashes.
That's how the topic starts.
That is correct.
And so tell us a little bit about hormones in general. How does that affect women from their first period through pregnancy to menopause? Tell us about the whole cycle in a nutshell.
So basically, we'll start from puberty, in which there is an uprise of estrogen, and that leads to changes of the secondary sex characteristics. Then you have adolescence, in which a woman starts having her menstrual cycle. Then there is pregnancy. Again, there is an uprising of estrogen, in which it prepares a woman for breastfeeding and also for labor. Then after they deliver a gorgeous baby, there is withdrawal of estrogen, and they start having certain symptoms, which means that they feel that they're shedding hair, their hair is thin, they have vaginal atrophy. Then there is what is known as the perimenopausal state, or the menopausal transition state, which is around the 40s. And menopause, again, like I said, it's a retrospective diagnosis, and the average age is 51.
So getting back to this period where women experience this after they've delivered, they have this withdrawal of estrogen, and that's like a precursor to what they're going to experience when they actually get into menopause, correct?
Yes, they start complaining that the vagina feels extremely dry, they're having hair loss, they feel fatigue, in addition to the hormonal changes, but they also have a newborn baby that they need to adjust.
And depression is another big thing.
And depression is a big thing as well.
So in my practice, I'm clinically based on aesthetics, and the big thing that I see women complain about is they complain about their skin. They have dryness, they see more sagging, and they feel like it's not necessarily even. It's almost as if they have this steady state of changes that go on, and all of a sudden there's like a cliff that happens, and they see these big changes that appears what in their mind with relatively soon, like within a year or two of their last period. They really see big changes, and obviously the hair is a big thing, the skin is a big concern, and the other big thing is that they complain about fat redistribution. They have fat changes where they lose the fat in hormonally dependent areas such as the breast and the hips, and they gain this abdominal fat. So it's not so much a fat gain, but a fat redistribution. they're kind of reversing some of the things that went on with puberty, and they kind of go back to losing some of that and gaining it in other places. So that's a big thing. Tell us about the big things that women complain about physically when it comes to the vagina, their labia, their clitoris. Tell us about the women's experience with that specific area.
So I'll just give you a clinical scenario. You have patients that come in their mid-40s or in their early 50s or even in their late 50s. And one of the most common complaint is a vaginal burning. They complain about vaginal burning, and sometimes they're mistreated. They're told that, oh, you have a yeast infection. And yet what they truly have is a deficiency of estrogen, because just like you mentioned, as far as the thinning of the skin, the vagina gets thin because you lose that collagen, right? And the vaginal epithelium, which is the lining of the skin, gets thinner. So they also have reoccurring urinary tract infections, urethritis. They also have pain with intercourse, which is known as dyspareunia. As well, some of them can experience, which is known as postmenopausal bleeding. But we have to be very careful that we can't say postmenopausal bleeding is just because of estrogen withdrawal. It could be due to other underlying causes that needs further investigation. Another thing that can happen is basically what's known as postcoital bleeding, and that could be attributed to infection, or that can be due to menopause. So those are common things that I deal in the office with.
And so they're bleeding and they have pain after sex.
Yeah. Another very common that I mentioned, 75% of women in the United States are affected by hot flashes. And hot flashes, basically, it definitely affects a woman's mood. And it changes her, you get a little bit anxious. They're like, oh my God, my wife is, suffering from anxiety. She's feeling depressed. So if a woman does not get a good night's sleep, how can she function? How can she function? So, and at this day and age, why do we have to suffer? There's multiple therapies out there versus hormonal versus non-hormonal.
So tell us about hormone therapies. What are the options that women have, and what in terms of pills versus patches versus implants?
So in my particular, before I start discussing as far as therapy, I do a thorough history and physical. I make sure her mammogram is up to date. I do a pelvic pelvic examination. I'll do an ultrasound to get a baseline information as far as to know what her endometrial stripe before I considered hormone replacement. Then I ask, what are your symptoms? What is actually affecting you more in life? If it's hot flashes, we have now hormonal therapy and non-hormonal therapy. And if she desires hormonal therapy, my other question is, it needs to be tailored to that individual. Does she have a uterus? Does she not have a uterus?
So there's a lot of medical things that go into tailor making your prescription or your advice on what the best options. Tell us, I hear a lot about this plant-based options for women for therapies. Tell us about that.
So in a woman that's in menopause, the most important thing, it's a series of things. I definitely recommend a very good, healthy diet, number one. Exercise is very important. Taking your vitamin A, your vitamin D, C, these are natural things that you can do. Your biotin, it's very important. Aside from that, if it's basically vaginal dryness, you can use what's no moisturizer. One of the most important thing in order to prevent wrinkles is hydrate. Hydrate with water and hydrate with creams. And now we have hyaluronic acid that we can use in our vagina in order to maintain that lubrication, that moisturizer. So it really depends on their symptoms, and it also depends on as far as their clinical background.
So I think this is an exciting time. I think people have options now. Like, one of the biggest things that I see in my practice is when I walk into a room, I can tell, like if I see a 60-year-old patient, I have a sense right away that they're on hormone therapies. I know, because they can be doing all the cosmetic things and have lifestyle and diet, but there's something very different about them. The experience that I have is when I ask them about it, they usually open up and they tell you how good they feel, how more confident that they feel, how they feel compared to their peers their same age. So there's this whole thing that a lot of women are really not sharing with other people because it's like a taboo subject. But when you see the women and you see how good they feel and how good that they look and how energetic they report that they are, you say, well, why don't more people know about this? Why is it such a hidden taboo subject?
So we basically need to eliminate this taboo. We're in a whole different generation, so we need to express ourselves. And why should we suffer from hot flashes? Just like when I have a patient that's in labor, why do you want to push without an epidural? Why do you want to have pain? So I think we need to, that's why we're here, bringing it out there, let women be informed. There's different therapies. There's hormonal therapies. There's non-hormonal therapies. And of course, if you are sleeping every night, you're going to be with more energy. You're going to feel more alive. But if you're having like 4 or 5 hot flashes during the night and you're not able to get a good night's sleep, of course you're going to have mood changes. Of course you're going to feel depressed. It's like, of course you're going to have brain fog that people discuss about that during menopause. And another thing, exercise is very important. Weight training is very important. Healthy diet. So there's a lot of things that come into play.
Well, I've had women tell me that they basically were doing everything. They were athletes, they had good nutrition, they went through menopause, and they experienced muscle loss that they couldn't seem to regain. And then when they started the hormone therapies, they felt like they gained that muscle back. They felt like they got that performance back. And a lot of women don't even understand or equate that as an option. They just think it's just aging.
It's not, you just feel fatigued and tired. So you really have to. But again, regarding the hormones, everyone is an individual, so you need to evaluate your, every person.
So the biggest question that women, once I bring this subject up to them, they say, well, where do I go? Where do I find a doctor for this? Because a lot of times their OBGYN doesn't give them this option that you give.
You need to do your research and also go to your OBGYN, have a nice, conversation. You need to feel comfortable with your doctor.
So
you need to be able to express.
So you think it's an individual thing? If they're not getting it from one OBGYN, they have to find another one?
Absolutely.
That's the big thing, is finding the doctor who can answer these questions.
Who's right for you?
So lastly, I just want to, what are some of the big areas for hormone therapies where women really wouldn't be good candidates?
The women that we don't recommend hormone replacement therapy, we basically recommend it to start in a younger age, not to start at 60, 65. So I recommend it ideally in that perimenopausal state. And contraindications, of course, are if they have coronary artery disease, number one, if they have any estrogen secreting tumor like breast cancer, endometrial cancer is not a good candidate. Any history as far as they have, a DVT, a venous thrombosis, is also contraindicated. Severe hyperlipidemia, the triglycerides are like above 500. You're not going to start a patient on estrogen that they can get like a stroke, a blood clot or so forth. So again, you have to tailor the treatment. You have to do baseline labs when you see a patient. You have to do their lipid profiles. You have to check their TSH. You have to do a thorough history and physical mammogram, as well as a pelvic ultrasound.
So there's a lot of medical details that go into this. It's not a quick decision, and it really comes down to serious medical discussions, and then the intimacy of your physician.
Absolutely.
Having that. When women go through menopause and then they experience the improvements from hormone therapies, we talked about what it is they go through to lead to. Once they get these therapies, what do they tell you? What's the feedback that you get from the women once they have the treatment? So
my patients are extremely happy. They don't want to stop their therapies at all because they just feel that they're alive again, like you just previously mentioned. They're able to function. They have a normal sex life again. They don't feel fatigued. They don't feel tired. They're not having these hot flashes that are interfering with their life.
It's like a reawakening.
Exactly. But remember, menopause is not a disease. It is just a stage of life. And we just need to deal with that stage of life.
And now we have options, and the main idea behind this podcast is to give women the idea that this is a normal part of life, and now they have options, and they should seek out the intimacy and the privacy of their own physician and discuss this and find what options are best for them.
That is correct.
So thank you so much for joining us, Dr. Ramirez. It's been a pleasure talking about this. I feel women can have the confidence to go and have these conversations now with their own doctors.